Hi everyone, welcome to this episode of Health Vibe. My name is Catherine Magsanok. Ako po ang features editor ng The Philippine Star and I am your health advocate dahil naniniwala po ako na ang ating health ay nasa ating mga kamay. Siyempre, we need to work with our doctors. Pag may mga alinlangan, ang pupuntahan natin na yung ating doktor, hindi ang Google at hindi ang kapitbahay na nagbibigay ng medical advice. And today, I'm very happy to say that our episode tackles on a topic that's very close to my heart, breast cancer, with a doctor who is from an institution na pwede nating puntahan anytime kung nag-aalinlangan po kayo. Pag-usapan po natin yan today with Dr. Kenneth G. Samala, who is in internal medicine. He also practices medical oncology, thoracic oncology, and takes care of adult diseases and is a cancer specialist.
Hello, Miss Kai, and very thankful for this opportunity to have this very meaningful conversation with you.
Medically verified information that's evidence-based is so important.
Right.
Lalo na napakaraming expert nagsilabasan nung pandemic, di
True.
ba? And ang health po natin, hindi nyo po iaasa sa taong nagpapanggap lang na alam niya. Kailangan po kausap natin talaga ang mga doktor na nag-aral para matulungan nila tayo sa ating kalusugan. Feel free to share but know that this does not replace your actual consultation with your doctor. Sa ating bansa, what should every woman know about breast cancer, especially those who might not be at risk? And of course, at Manila Doctors Hospital, with the patients that you meet, ano yung mga misconceptions that you have to debunk?
To answer the first question, Miss Kai, no? So I do get a lot of questions and comments also from patients, no, na parang, am I at risk? Wala naman po akong family history. But I think the most important message that, of course, we want to tell our viewers initially is that there are two risk factors, biggest risk factors for breast cancer. No? Number one is gender. So for women, it's really the most common type of cancer among women. In the Philippines, we have about 154,000 new cases of cancer each year. And unfortunately, number one doon is breast cancer. So definitely, there are some women that, they might think that they are not at risk, but actually being a woman or being female is already putting you at risk of developing breast cancer. The second one is age. So unfortunately, all of us will eventually age. So that's another thing that we need to consider, as a risk factor for breast cancer. In terms of misconceptions, and Ma'am Kai mentioned it a while ago na, a lot of people would like to go online and search for things, and kapag may nabasa sila doon, yun na yung paniniwalaan nila. One of the common misconceptions I've heard, like wearing bra or wearing tight-fitting bra. So parang nag-cause daw yun because naiipit daw. But in all honesty, it's not a known risk factor for developing breast cancer. I'm also heard about doc kasi natamaan. Probably playing sports or parang they were doing something and then natamaan. And again, that's not a known risk factor. And sometimes I would just tell them na baka po kaya siya na-detect, nalaman na may bukol kasi nung natamaan, sa kanilang na-feel. Kasi kikinapa nyo siya. Deodorants and antiperspirants. Minsan naisip ko baka rin dahil malapit siya dun sa
lymph nodes ba?
Yes,
sa ating
oo.
underarms.
So siguro when they apply, minsan may nakakapa sila din. Of course, they would relate it to breast cancer. So that's why I think it's very important that if you have any questions, it's important to, seek the experts, consult your doctors and ask if these are actually risk factors, because we do have risk factors for breast cancer. Meron naman talagang known risk factors, and we do see breast cancer among males, but it's not very common, very low, at probably less than 1%. Of course, advancing age is also another risk factor. Not having a healthy lifestyle, because that puts you at risk of obesity or gaining weight. That's also a known risk factor. Vices, alcohol consumption, smoking as well. Those are two things that can also, which I think is preventable. So again, probably that's one of our early messages. If you can avoid yung vices like smoking and alcohol consumption, I think not just for breast cancer, I must say, but bababa yung risk factors nyo, not just for cancer in general, other types of cancer, but cardiovascular diseases as well.
Because they're all linked.
They're all
anyway.
linked, exactly.
Why I love doing Health Vibe is I represent the patient. I ask questions that patient might be afraid to ask their doctors.
True.
And I'm taking this opportunity to remind our patients to lose the fear of your
Yeah.
doctor. Do not hesitate to tell your doctor. Head over to Manila Doctors Hospital. They're with us every step of the way. So, Doc, early detection. Why are there cancer patients who are younger women? Okay, yung iba 20s or 30s.
Yeah.
So that one, and then of course, what is the importance of early detection and how does Manila Doctors Hospital support this?
Totoo, Miss Kai, no, I'm seeing in the clinics, I have seen it not just for breast cancer, but for other types of cancer as well. I've seen younger patients. And I do think that it's probably brought about by two things. The first one is on a more positive note. So probably because we have more sophisticated equipments now, diagnostics. So we're able to detect cancers quite early. No? Kasi we have tests already. Or for example, if someone feels a lump or a bump, then they can go to their physicians or go to a hospital and they get examined. So yun yung isa. So more positive. But the other possible explanation, which is actually a bit more on the negative side, is probably because there's a shift now in the lifestyle choices of people nowadays. Before kasi, for example, we have a cleaner environment for one. People tend to be more active, no? They would walk, they would do physical activities. Now we're confined to our homes or in the computer or doing in our mobile phone. So, and I guess this sort of like shift in the lifestyle choices can potentially also contribute, no? And lifestyle choices, not just physical activities, so probably with the diet that we're getting, no, that we're eating, that could potentially add as well. I think I don't have a straightforward answer to that, but probably it's likely a combination, no, nung dalawa po na yun. And then for screening for early detection of breast cancer, that's when we start recommending mammogram.
Okay.
So mammogram is a breast cancer screening tool that we use. Usually the recommendation is we start it at the age of 40. So sometimes if I have a younger patient and they really want to have themselves screened, sometimes I offer breast ultrasound. So that's another thing. Self-breast examination. Although some of the studies abroad, or especially in the US, they don't actually advocate it, no? But for me, I think there's no harm in doing a self-breast examination. Basically, we recommend doing it 5 to 7 days after their menstruation. Kasi sometimes if you do it right before menstruation or during your menstruation, then sometimes because of the hormones, so the breast feels tender. So baka hindi niya ma-palpate or ma-examine completely. So we always advocate doing that 5 to 7 days, no? And then clinical breast examination is a physician or a healthcare professional does the examination for you. So I know we have some annual physical examination if you're at work. Sometimes you can include that, no? Minsan, di ba, they will include that. So pwede nyo pong ipasama yan. But I think the most important key message there is if something doesn't feel right, that's also one of the things I tell my patient. Because tayo lang po yung nakakakilala sa katawan natin.
Yeah.
It's very important, to do this examination once in a while. So if something doesn't feel right or it doesn't seem like that a month ago or a few weeks ago, then that's usually our opportunity to seek consult. Just to share with you, the first ever 3D tomosynthesis in the Philippines and in Southeast Asia was actually launched in Manila Doctors. So we're used to the usual mammogram, 2D, 3D mammogram, but this one is the more sophisticated one. So it was launched in 2018. So I believe the Manila Doctors had the first one in the Philippines and Southeast Asia. It's a testament of how committed Manila Doctors is in really elevating healthcare here in the Philippines.
Okay, you started speaking na to the women or our audience who are tuned in to our Health Vibe episode. And I agree with them knowing their bodies, right? So Ako, I check the shape, I check my skin, I know when it's itchy,
Yeah.
right? And I check, di ba?
Yeah.
Kasi skin din yan, minsan meron ding pimple,
Yeah.
ganyan. Just to
Skin
be very
changes, yeah.
real talk lang to. Gusto ko pong tanggalin yung shame, talking
Yeah.
about our bodies and our fears. Getting screened or consulting for breast concerns can be scary for many women.
Yeah.
So, Doc Ken, kausapin mo nga pasyenteng nakikinig ngayon, even the men. What would you say to them if they are going through anxiety or are afraid?
May term akong tawag dyan scanxiety.
Scanxiety.
When patients feel
That's
very
good.
anxious before
I'll take
they
note.
get themselves scanned. And it's a reality, no? Of course, there are some cases where I would have to convince them to get themselves biopsied or have themselves screened. And sometimes I would get answers like that. No, wag na lang natin i-check kasi baka magkaroon. Which is, like, it's funny, but it's really, it's like, how do you approach that, no? It all starts with the environment, with the atmosphere. You have to convince, kasi getting yourselves checked, the anxiety is already very high. And then, pupunta ka sa isang hospital, and then you feel more stressed getting there. You don't feel welcome. You don't feel comfortable. And then, the anxiety just adds up. And again, definitely that will happen. Na, you know what? I'm just gonna give up. Aalis na lang ako. Wag na lang. Bahala na. No? And so, I do think na it all starts with definitely providing us, like you mentioned, a safe space, a safe and comfortable space for patients. My advice then for patients and their families, no? You have to be there with them. You have to hold their hand. We have to understand that it's not easy going through something like that, no? So it's very important that we hold their hand and we show them that we are there. We lend support. And of course, there are some patients na, I'll just talk to you. I'll just reach out if I need to. And I think it's very important for them to realize na, yung family member ko, sige, hindi man ako laging masasamahan, but whenever I would need them, they would be there for me. So, I think it's also important for patients na to think of it as self-care and self-love. Because when you take care of yourself, when you get yourself screened, that's the ultimate form of self-love and self-care, And when you think about it, if I take care of my body, then I'm also able to take care of my loved ones as well. And we're very happy at Manila Doctors kasi we're actually just undergoing renovations. So, and we're continually committed to providing a comfortable and welcoming environment for our patients.
Well, that gives me hope that there will be more Filipinos who can overcome their fear and their shame and feel like there are safe spaces they can go to, no? Yeah, kasi my mom is a breast CA survivor. My tita is a breast CA survivor. I have a cousin who's a breast CA survivor, Kara Magsanok Alikpala, who founded I Can Serve.
Yeah.
So I'll segue to that. Ang mga pasyente po at ang mga carers ng mga breast cancer patients, it's very emotionally, mentally, even physically taxing for us. So there are support groups that we can turn to. We're not going to talk about them, but if you want to know who they are, you can reach out to Health Vibe here at the Philippine Star. Message nyo na po ang aming napakahusay na social media team. Or please message Manila Doctors Hospital. They will help you out, no? Point you to the right support group. Today, treatments have come a long way. What developments give patients and families more hope compared to 2 years ago? And which treatment options are already available at Manila Doctors Hospital?
That's a very good question, and I think this is a great opportunity for us to inform everyone, na gone are the days when you think of cancer as that's the end point of it all, na parang death sentence na siya. Whenever I would talk to my patients, kasi right now, marami na tayong options. Not everyone will get chemotherapy. Hindi lahat chemotherapy offer. And sometimes, yung mga patients ko na I call them magka-classmates na sila. Kasi when they go for their chemotherapy treatment while at the waiting area, of course, they follow the same schedule of every 3 weeks usually. And sometimes nag-uusap sila, but sa'yo ito yung gamot, and they're both, for example, breast cancer, but ito sa'yo yung binigay, but sa akin hindi. And then they would ask me, and I would tell them, ma'am, kasi right now, hindi lang chemotherapy yung options. No? We have many other options. We have immunotherapy. Probably heard about it. It's one of our poster boy for targeted therapy. No? Maraming mga sakit, cancer na ginagamitan namin ng immunotherapy. Meron na rin pong concept of what we call targeted therapy. Usually they're in pill forms. So yun yung common ko nakaka-encounter sa clinic. Dok, bakit yung si naka-tablet lang daw siya, but ako hindi? And then I would have to explain to them. So it's actually nice that we have so many of these treatment options. And pag kinakausap ko nga yung mga patients ko before, alam nyo po, kung 15-20 years ago, we have very limited options, no? Kahit nung when I was still in training, probably in med school, when we tried to study cancer, lahat ng treatment options was just chemotherapy. But right now, because of the advances in science and technology, we have so many treatment options. So cancer is a smart disease. So our tendency is to outsmart it with this newer treatment medication. So I've mentioned about chemotherapy is always going to be there. Meron na rin po tayong immunotherapy and targeted therapy. And we're very happy because these medications we can administer them all sa Manila Doctors Hospital. No? So we have an oncology infusion unit. The good thing about this is that oncology infusion unit, most of the treatments that we have for breast cancer are just outpatient as much as possible.
Okay.
So, doon pa lang, parang malaki na yung cost na masisave ng patients because, like, being admitted entails so many excess expenses. So, because we do have like oncology infusion units, we're able to, infuse medications there a couple of hours, 3 hours, and then nakaka-uwi din po yung patients at the same day. And then, this is true, of course, for chemotherapy, immunotherapy, we have that. And of course, yung targeted therapy is easier to administer kasi usually it's just in the pill form. But yeah, we're very happy because we're able to do that all at the oncology infusion unit at Manila Doctors. And in addition, not just the treatments, but we've also upgraded our equipments. So yung other modalities, treatment options for breast cancer, like radiation. We have a linear accelerator. I think one of the latest linear accelerators model in the country. We have that at Manila Doctors. We're able to do more now with our newer machines in radiation oncology. So aside from the chemo part, aside from the infusion, we also have treatment options. Recently had launched our PET scan as well.
Ayan. So talagang living up to the reputation as a center of excellence in oncology, no? So what do we expect from Manila Doctors Hospital in terms of breast cancer care? What sets it apart, Doc Ken, aside from the fact that you practice there?
I guess very true to our mantra. You pointed it out, Ms. Kaino, with you every step of the way. So I think that adds a level of comfort, care, humanity. Kasi sometimes cancer is, I'd like to call it a catastrophic disease. Catastrophic biologically, there's so many things going on in your body. Catastrophic emotionally, catastrophic financially. So I think it's very important that you have a venue, you have healthcare professionals that actually, that will be there for you, hold your hand, like I said a while ago, and with you every step of the way. And I think true to our commitment to being a center of excellence, we have very compassionate physicians, and not just our physicians, we have oncology nurses, nurses that really specialize in the field of cancer treatment and management. We're very confident with our nurses, whenever we let our patients be under their care. Kasi they're very trained. We have pharmacists. We also have other allied medical professionals working together. And it really highlights the importance of that multidisciplinary approach. So I guess that's also one of the things that we are very proud of at Manila Doctors. We work very closely with other physicians, other specialties handling cancer, as well as the other allied medical professionals handling cancer care. So yeah, so that's probably the level of care that you're gonna get there.
So it takes a village. There is a care team.
There is a care team.
How do you collaborate with the other members of the care team? So I know that you're really taking care of one patient, you're taking care of me.
The center should have all of these different specialties handling patients. So, yun yung number one requirement. No? And for us at Manila Doctors, we have medical oncologists, we have radiation oncologists, we have, of course, surgeons, and we even have surgeons that have specialized in cancer surgery and treatment. So, and of course, we have our allied medical professionals, we have a nutritionist, we have a palliative care specialist, we have pain specialists. So, when you think about, we always look at the patient, and this is true for any patient, but more so for cancer patient. Titingnan namin yung isang pasyente ng cancer as a whole. Na it's very easy kasi na i-treat lang natin yung cancer itself. But, of course, maraming issues. They might have pain issues.
Right.
So, we're very lucky that we have pain specialists at hand that we can just easily refer to. Another challenging probably for cancer patients is nutrition.
Yeah.
So sometimes, I would encounter patients na, Doc, andun yung gusto mong kumain but wala ka talagang gana. And of course, sometimes they would lose weight. And that would snowball very significantly. They lose weight, they're not eating, they lose weight, they're not able to get their treatments. And of course, the cancer might progress. So again, we're happy na we're very much, it's very easy for us to just refer our patients to our nutritionists. So I guess the thing about in Manila Doctors is that, number one, we do have all of these specialists available. It's like calling a friend. And then we practice multidisciplinary team approach. Easy for us to just communicate with them. These are my needs. These are the things that my patient needs. And the communication is definitely two-way. We were able to air our concerns and update each other as well. So I guess that's a very important piece when you want to take care of cancer patients.
Okay, thank you so much for that, Doc. And it makes me happy to know that we're looking out for the patient experience also, not just for their healing, diba? Not just for their healthcare.
Exactly.
Okay, as my last question, your message to patients or the women who are listening, whether they're patients or not, what they can take away from this conversation, and also the loved ones. There could be loved ones who are listening, taking care of a cancer patient already. Ano po ang inyong huling mensahe sa kanila?
Okay, so probably one of my takeaway is quite simple. So the prevention is about healthy living, but survival is early detection. That's why we talked there. We had a conversation about early cancer screening, why it's important to do these things, because it's very important for us kasi it will impact a lot of things in the aspects of the lives of our patients and their families as well. And probably I mentioned this a while ago. It's I think taking care of oneself is the ultimate expression of self-love and self-care. And if we're able to take care of ourselves, then we're able to take care of our loved ones as well. And probably, don't be afraid to talk to your physicians. And for the families as well, I think it's very important to lend a helping hand and support your family members who are probably going through something. I think it's very important that you have that sort of like a support system with you when you go through something like this.
Okay, Doc Ken, I will add on to that. Siguro a fourth would be cancer is no longer a death sentence, but the key is early detection.
It is,
right?
Yeah.
And number 5, another learning is we have doctors like Dr. Ken Samala who can give us a safe space so we can be open. And if you're waiting for a sign to discuss breast cancer with your doctor, whether you're male or female, or to get started with scheduling your mammogram or ultrasound or both, this is the sign. do make the world a better place. Share this episode so that people can learn more about breast cancer, and institutions like the Manila Doctors Hospital, who are with breast cancer patients every step of the way. There is a care team who will take care of you. So with that, we end our Health Vibe episode today. Thank you so much, Doc Ken, for giving us your time, your energy, and for connecting with the patients who are tuned in. At sa mga pasyente pong nanonood, so Pasko na po, sabi nga ni Doc Ken, ingat sa mga vices, di ba? Ingat sa pagkain, ingat sa pag-inom, alalay. Magtanong kayo sa doktor, hindi po ako talaga pwedeng hindi uminom, hanggang kailan po ang safe. Siyempre, preferred po ang hindi. Pero kung gusto nyong makisama, kung hindi pwedeng props lang ang hawak, tanungin nyo po hanggang gaano po yung at least alam ko na hindi ko ilalagay sa risk ng cancer ang aking sarili. Because when we take care of ourselves, that shows how much we love the people around us and ourselves, and we honor our God who created us, gave us this body. So until the next episode of Health Vibe, this has been Catherine Magsanok of the Philippine Star. Take care and be well.